It's 9:01 right now. New possible changes coming to Denver Health this morning. The hospital held a discussion panel to talk about what's next.
And this is where we can find your reporter, Justin Adams, this morning. Justin, you're at the panel. What did you learn this morning?
Well, Brian, today was an opportunity for the four-person panel to talk about some of the possible challenges when it comes to the future of healthcare, specifically within Denver Health. Now, there are three main subjects that were highlighted, which discuss the future of Medicare and Medicaid. The panel was firm on their stance to make sure that Medicare or Medicaid would not be limited in the future. Next, making sure that there is enough funding for migrants to have medical care, specifically when it comes to care that comes directly from Denver Health, which connects with the final point of making sure that everyone continues to have access to medical care, which the panel agrees is vital for everyone.
We value access to health as a human right in the state of Colorado, then everything else should flow from there. If we don't value that, then that leads to a different set of decisions. I value that. I think most of the folks on the panel value that. Seeing a fair number of nodding heads in the audience that value that as well. And so it becomes a question of, do we balance our budgets on the back of the poor and the vulnerable, or do we not balance our budgets on the back of the poor and the vulnerable?
Now, Brian and Michelle, the four-person panel just finished up speaking about 30 minutes ago. And as you heard on the first part of the soundbite, it comes all about human care, just really caring about the next individual, which is really the heartbeat of what this panel was speaking about today. Live in Denver, I'm your reporter, Justin Adams, covering Colorado First.
All right, Justin, thank you.